Hi guys, welcome back to another video. So guys, today we are talking about problems related to menstrual cycle. By the time you're watching this video, I think you're in a position to understand, or you already know, or you by this time I know you can know, or you know some of the how you can manage period pains, because we had already talked about it. Signs and symptoms of menstrual cycle, we talked about it. Signs of ovulation, you already know. You know which type of family planning is best for you. If you don't know, I can help you. Also, you know some of the things related to uh, monthly period. So what we are going to look at today, things we are going to focus in are common menstruation problem. Yeah. So those are the things that we are going to talk about today. So menstrual cycle issue can range from irregular periods to severe pain to so many things that we are going to look at in this video. So number one problem that you might notice is irregular periods. That is number one problem. Or you can talk about oligomenorrhea. Yeah, oligomenorrhea. So most of the time you get that this condition or this problem come when a person experience, or how it will happen. You will experience too early menses, or too late, or unpredictable. But the cause you might get that there because of hormonal imbalance. Yeah, hormonal imbalance, where we will look at some of the hormonal conditions or conditions related to hormonal imbalance. Also severe stress. Some people, if they have some stress, this is what they will experience. If you get an extreme exercise, you can experience it. If you're using birth control, can also affect. Yeah, or you can get early menses or too late menses. Also, another problem is about heavy bleeding. Also, can be caused by polycystic ovarian cyst, hormonal imbalance, bleeding disorder, endometriosis. Yeah. Another thing that can also be a problem is painful period, which most of the ladies usually experience. And this, you can, when you're experiencing the painful menstruation period, which you know as dysmenorrhea, you will feel back pain, nausea, vomiting, headaches. Some people even vomit. And dysmenorrhea can be primary or secondary. Where primary you get normal cramping due to prostaglandin, and the secondary you can get you might get that you have another cause of it. For example, you can have endometriosis, or maybe you can have fibroids, among others. Something is causing it when you're having a secondary dysmenorrhea. Also, another thing that someone can experience is absence of period, amenorrhea. Amenorrhea is common when someone has given birth and their periods has not returned. Also, if you're breastfeeding, you can experience amenorrhea. Also, when you're pregnant, amenorrhea. But if those conditions, those things that I've not mentioned, those things that I've mentioned are not causing amenorrhea, then it is a problem. It can be caused by extreme weight loss, uh, extreme weight gain, and also stress. If you have hormonal imbalance conditions, they can cause it. Also, remember, we have primary amenorrhea and secondary amenorrhea. We're going to talk about all these things here, so stay tuned so that you get to know what are these secondary amenorrhea, what are these primary amenorrhea. Yeah, these so many things we are going to talk about them. Also, if another problem that might set in, or period problem that might set in, is premenstrual syndrome, PMC. Premenstrual syndrome, this is just symptoms where someone gets mood swings, severe mood swing, they get bloating, headache, vomiting. Some people, when they're having their menses, they usually suffer from this premenstrual. If they're about to have their menses, they suffer from this problem, the premenstrual syndrome, 2 weeks before menstruation, yeah? Or 2 days, between 1 to 2 weeks before menstruation, you will get those problems. The cause is just the hormones of imbalance of serotonin hormone, and then the imbalance of hormones that influence the menses, that is the estrogen and progesterone. Number 6, we have the spotting between periods. Also, you get that all these problems that are coming because of your menstrual, all the problems that you experience when you're having periods, or problems related to menstrual period, most of the causes are hormonal imbalance. Yeah. So yeah. So you have to know, you deal with the hormones first, so that you. So spotting in between periods also is another problem, and the cause is the same. We have short or long menstrual periods. Some people have short cycle, and some people have long cycle, longer than 35 days, and shorter than 22 days. Those are the standard days. So remember to track your cycle. If you don't know, contact me so that you get private consultation, so that you know what is happening to you. Also, yeah. So those are some of the problems that are related to menstrual period. Yeah, those are the problems that are related to menstrual period, and most of them have said that they are caused by imbalance of the hormones, the estrogen, the progesterone, the serotonin. Yeah, those hormones that affect the menses, or they affect the monthly period, or ovulation, or all those hormones. You get that they are the cause, or they are the factor that bring all this problem. So guys, we will talk about all this about amenorrhea. We will talk about them in details. So stay tuned. Make sure you subscribe so that you don't miss any other. Yeah, so that you don't miss any other video that we post on this channel. So bye till next time. Let's meet in the next video.